Hello, everyone, and thank you for joining me for this presentation today. This presentation aims to just give a high-level overview of the systematic review that's entitled Vitamin D Supplementation for Metabolic Syndrome Risk Factor Management in Postmenopausal Women, a systematic review. So before we jump into the systematic review presentation, I just wanted to take a moment to introduce myself. As your presenter, my name is Caitlin Gass. I am a graduate student at the University of New England and currently as a candidate in the Masters of Applied Nutrition program. Prior to entering this program, I received a Bachelor's of Science degree in Food Science and Human Nutrition with a minor in Exercise Science that was completed at the University of Maine in May of 2014. And since that graduation date, I have had primary work experience within a couple different facets. Initially, primarily in the clinical nutrition support career field within a hospital setting in Southern Maine at Northern Light Health. And after completing that work experience, I moved into my current role as a case specialist absence management trainer with a corporate insurance company in the Southern Maine region and currently working in employee benefits in a full-time training role. So through both of these career opportunities, I've really developed a passion for workplace wellness and health promotion implementation. So now that I've introduced the systematic review topic and myself, I just wanted to take a moment to outline what we'll be covering today in our high-level overview. So our outline for today is going to include the systematic review objectives, the background and introduction to postmenopausal women, vitamin D deficiency, and metabolic syndrome. We're going to discuss the research question that was included in the systematic review. We'll discuss the methodology and search criteria for the included articles in the systematic review. We'll take a look and analyze a few of the key randomized controlled trials that were included in the systematic review. We'll dive into a synthesis and comparison of the results rendered from the systematic review. And finally, we'll take a look at the discussion and conclusions that can be drawn from this overall review, as well as some strengths and limitations of the present information that we have. And finally, the implications for any further research in the field. The objectives or purpose of this systematic review really aim to determine if supplementation of vitamin D will have any effect on reducing metabolic risk factors in the postmenopausal population. This systematic review really aims to examine supplementation studies conducted on vitamin D deficient postmenopausal women to determine if reestablishing positive vitamin D status plays a significant role in decreasing the risk of metabolic syndrome. So now we're really going to dive into how postmenopausal women are affected by metabolic syndrome and why lifestyle modification factors are necessary, as well as first and foremost addressing what metabolic syndrome is and what the risk factor or diagnoses criteria include. Postmenopausal women, of course, have completed menopause, and this is typically going to occur between the ages of 45 and 55. This is going to lead to a decrease in sex hormone production, such as decrease in production of estrogen and progesterone, which is unfortunately associated with a cardiovascular disease and metabolic syndrome risk. Again, this is going to require additional research in order to identify adequate lifestyle management protocol, and we're going to discuss some research studies within that systematic review that had aimed to actually accomplish this. Now, taking a look at the metabolic syndrome risk factors and the diagnosis criteria is important when examining this postmenopausal population. Metabolic syndrome is categorized by really insulin resistance along with two of the following criteria. So we're looking at abdominal or central obesity, hypertriglyceridemia, low high density lipoprotein or HDL, cholesterol, high blood pressure, or documented use of antihypertensive therapy, a high fasting glucose or impaired glucose tolerance. This also includes insulin resistance or diabetes, as well as microalbuminuria. So these are all going to be risk factors that are associated with the diagnosis of metabolic syndrome and things we should be looking out for in the postmenopausal women population. After identifying the metabolic syndrome diagnosis and the associated risk criteria, we can take a deeper look at how this specifically applies to postmenopausal women. The risk factors for meeting the metabolic syndrome criteria that closely affect postmenopausal women include obesity. This includes gain and redistribution of weight, abdominal body fat distribution, lack of physical activity, poor diet with excess caloric intake, exposure to certain medications, the genetic makeup of this population, socioeconomic status, and finally, the most important for this systematic review, low levels of vitamin D. And based on the present literature, there seems to be an increased risk of metabolic syndrome in the postmenopausal vitamin D deficient population by about 33 to 42%. So now that we've examined postmenopausal women and their incidence of metabolic syndrome risk, and we've examined metabolic syndrome risk and diagnosis criteria, we really need to take a look at how does vitamin D really fall into this trifecta. Right now, there are still a lot of unknown components, but the current literature shows an increased incidence of metabolic syndrome in obese postmenopausal women. When we examine vitamin D itself and its role, we see that vitamin D is actually classified as a hormone because there are receptors for vitamin D on almost every cell within the body. Vitamin D itself plays a role in cardiometabolic health, and deficiency or insufficiency in vitamin D can disrupt certain bodily processes. Vitamin D is a fat-soluble vitamin and can be actually sequestered within adipose tissue, which can cause an issue in postmenopausal women who are obese or with central adiposity, as these are actually risk factors associated with metabolic syndrome, as we've seen in our previous slides. Postmenopausal women also may have barriers to sunlight exposure due to their place of residence or protective measures that can interfere with the conversion of ultraviolet B rays into vitamin D by the skin, further resulting in potential for vitamin D insufficiency or deficiency. Overall, there seems to be an association between low levels of vitamin D and increased risk of metabolic syndrome. Currently, the interaction is still being studied, but there has been an association hypothesized. This association can be seen in a few different possible interactions. Vitamin D may have effects on the renin-angiotensin system within the body. Vitamin D may have a role in glycemic control, a role in involvement with inflammatory cytokines to combat immune response, and a role in regulation of parathyroid hormone levels. There was a Korean study conducted that showed higher serum vitamin D levels were associated with a reduction in metabolic syndrome components, such as blood pressure, triglycerides, and an improvement in high-density lipoprotein cholesterol, or HDL. Based on these potential associations between postmenopausal women, vitamin D deficiency, and metabolic syndrome, the research questions that are proposed by the systematic review include: does vitamin D supplementation, a minimum of 600 IUs daily, over at least 8 weeks, increase the risk of metabolic syndrome in vitamin D deficient postmenopausal women aged 40 years to 80 years? Furthermore, if vitamin D supplementation in deficient postmenopausal women decreases the risk of metabolic syndrome, what biological markers or conditions are most affected? And finally, does vitamin D have an associated role in cholesterol management in the postmenopausal group? So now we'll move into the actual methodology used behind how the included articles were identified in this systematic review for selection. The preferred reporting items for systematic reviews and meta-analyses, guidelines, or PRISMA for short, were utilized in conducting the systematic review. Within the review, 107 total records were identified. This includes all research articles for identification. Out of these 107, 92 articles were actually screened after duplicates were removed. 19 of these articles were actually assessed for eligibility for inclusion within the systematic review. And finally, after all assessments were completed, a total of 15 articles were included in the systematic review. There was a total of 5 search inclusion attempts on this systematic review. The first one included mesh terms, postmenopausal, vitamin D, and deficiency. And the second through fifth search attempts included the addition of cholesterol, triglycerides, obesity, hypertension, high blood pressure, diabetes, and insulin resistance added to the original mesh term search, as these are all keywords involved in metabolic syndrome criteria identification. 3 search databases were used in this identification of research records. Those included CINAHL Complete, Embase, and PubMed. And we were analyzing for all articles that were written and published within the last 30 years, which includes the years 1990 through 2020. When it comes to study selection, we had some inclusion criteria that was required to be met in order for articles to be included in the systematic review. As previously stated, the articles needed to be published within the last 30 years, 1990 through 2020. Full text had to be available in the English language without translation service. The articles had to be conducted as a randomized controlled trial study. And at least one group within the randomized control study had to utilize at least 300 IUs of vitamin D supplementation for at least the initial review. As we know, our original research question asks for 600 IUs of vitamin D supplementation or more. The inclusion criteria also included postmenopausal women aged 40 to 80 years, had to address at least one risk factor associated with metabolic syndrome, and the studies could also include a potential weight loss plan or prescribed diet associated with metabolic risk factor reduction, or a pre-prescribed medication regimen such as for dyslipidemia or cardiovascular disease. When it comes to quality assessment and final selection of these articles for inclusion in the systematic review, again, a total of 15 final randomized controlled trial studies were selected for inclusion. These were then further analyzed for quality criteria, utilizing the quality criteria checklist for primary research. This is included in the Academy of Nutrition and Dietetics Evidence Analysis Manual, Steps in Academy Evidence Analysis Process. These articles were assigned a rating of positive, negative, or neutral to identify quality of selected study. In total, 11 articles were given a positive rating, 1 was given a negative rating, and 3 were given a neutral rating. We are now going to take a look at 4 key research studies that were included within this systematic review to give you some insight into exactly what articles were utilized for inclusion. Our first article for review was conducted by Ferreira et al. In this article, vitamin D supplementation was analyzed for its effect on metabolic syndrome risk as a whole. This was a double-blind randomized control trial conducted in Brazil in 2019, one of our most recent randomized control trials for this condition. It was funded by grants from Sao Paulo Research Foundation and given a positive rating. The study itself included 160 postmenopausal women, and they were given 1,000 IUs of vitamin D supplementation for a period of 9 months. The assessment contained review of anthropometric data, total cholesterol, HDL cholesterol, LDL cholesterol, triglycerides, glucose, insulin, and vitamin D. Besides vitamin D, all components of metabolic syndrome risk. Individuals included for participation were vitamin D deficient, and our intervention and control groups each contained 80 participants. Overall, the results showed an increase in vitamin D levels in the intervention group by 45.4%, and our results showed a reduction in triglycerides with improved insulin in our intervention group receiving the vitamin D supplementation. All in all, daily vitamin D supplementation within this study of 1,000 IUs per day reduced metabolic syndrome risk through a decrease in triglyceride levels. Our second key article for analysis was conducted by Catalano et al. This research study utilized vitamin D supplementation and looked at its effect on lipid profiles. As we know by our previous slides, lipid profiles are a direct criteria regarding metabolic syndrome risk. This randomized control trial was conducted in Italy in 2015 and funded by the University Hospital of Messina. This article was given a positive rating and included 57 postmenopausal women who were vitamin D insufficient or deficient. This study utilized two different types of vitamin D supplementation through calcifediol and cholecalciferol. Each group had about the same amount of participants with 29 versus 28, and these participants were also prescribed and taking an atorvastatin for dyslipidemia. There were two groups conducted for 24 weeks, each group receiving 5,600 IUs of their choice vitamin D weekly, and the study analyzed lipid markers including HDL, LDL, and triglycerides at both the baseline and the endpoint at 24 weeks. Overall, serum vitamin D increased in both groups, and the calcifediol group reduced LDL and increased HDL at a significant level, resulting in calcifediol improving HDL and LDL profiles in postmenopausal women already taking atorvastatin for dyslipidemia. So the results of this study show that with an additional component of taking dyslipidemia medication, the supplementation of vitamin D can potentially increase or at least assist in reduction of lipid profiles, which again, in turn, can reduce metabolic syndrome risk. In our third study included for key analysis, we have a study conducted by Wood et al. In this study, vitamin D supplementation was analyzed for its effect on metabolic syndrome and cardiovascular disease risk factors. It was a randomized control trial conducted in the United Kingdom in 2012, funded by the UK Department of Health, and given a negative rating for this systematic review quality control. This study consisted of 305 postmenopausal women with an intervention of 400 versus 1,000 IUs of vitamin D. So there were two groups included in the intervention versus a control receiving just a placebo. This study analyzed HDL, LDL, triglycerides, insulin resistance, and blood pressure over the period of 1 year. The results showed that the intervention had no significant effect on lipid profile, insulin resistance, or inflammatory markers, and we can conclude that improving vitamin D status through supplementation is unlikely to reduce CVD or metabolic syndrome risk factors. And finally, in our fourth key study, we have Moghasani et al. In this study, vitamin D supplementation and its effect on cardiovascular disease risk, including lipid profile, blood glucose, and blood pressure, were analyzed. This randomized controlled trial was conducted in Iran in 2014, and given a positive rating by the Systematic Review Quality Review. There were 76 postmenopausal women with vitamin D insufficiency included, and our intervention was given 2,000 IUs of vitamin D daily, while the control was given a placebo. Over a 12-week period, the study groups were analyzed, and baseline lipids, fasting blood glucose, and blood pressure were assessed, as well as the conclusion of the study. In the end, no significant difference in analysis markers were seen after 12 weeks. And unfortunately, vitamin D in this study is unlikely to reduce cardiovascular disease risk factors by their results and conclusions. Once all 15 included articles were reviewed and analyzed, they were broken down into appropriate groupings based on what risk factors associated with metabolic syndrome that they aimed to address. In terms of study result breakdown, all included studies addressed one or more risk factors associated with metabolic syndrome. These studies range from positively affecting lipids, blood pressure, and hyperglycemia to having potentially adverse effects on certain lipid levels. On this slide, we can see 3 of the breakdown levels that were included in the vitamin D supplementation included articles. We had 2 articles that addressed overall metabolic syndrome risk, all encompassing the entire myriad of criteria. We had 6 studies that addressed lipid management specifically, 5 studies that addressed blood pressure control specifically, and 1 study that addressed caloric restriction specifically, and finally, 1 study that addressed inflammation markers specifically. These studies focused on glycemic index control and reduction of metabolic syndrome or cardiovascular disease risk through the long-term presence of acute response inflammation markers. Based on the results that were analyzed, we were able to break down the included studies to obtain clear and not so clear conclusions. As we can see on this slide, again, 15 selected studies were included for inclusion on the systematic review. Overall, there were 6 positive improvements in lipid measures, with 9 insignificant results. It's difficult to identify trends between study purpose, population, intervention, and results associated with decreased metabolic syndrome risk. But there is a possibility that vitamin D supplementation in deficient or insufficient postmenopausal women could decrease metabolic syndrome risk factors. Based on all of our information, including our key studies, there is additional ongoing research that is needed. The overall strengths and limitations of the studies included in the systematic review, as well as the systematic review itself, include the strengths: isolation of vitamin D supplementation within our included key articles, different supplementation rates that we were able to analyze between the different included articles, as well as a difference between supplementation timeframes. We were able to take a look at a lot of different supplementation timeframes throughout the 15 included articles. But as always in research, there are limitations. Some of the articles that were included additional supplementation components, such as medication, caloric restriction, weight loss, or potentially other hormone therapy. This didn't allow for a complete isolation of vitamin D supplementation and its effects on postmenopausal women and metabolic syndrome risk. There was a bit of a lack of consistency in follow-up time frame on each of the articles. Not all articles addressed a follow-up time beyond just baseline and the end result of the study. And finally, we always have to account for study dropout and adherence to the actual supplementation of vitamin D. When it comes to future research implications, it's clear that limited studies focus directly on vitamin D supplementation within this postmenopausal population. There needs to be a focus on creating a systematic approach to studying the actual impact of vitamin D and how it affects the study population. Recommendations for future research include to utilize the study design conducted by Ferreira et al. As a tool of initiation for future studies. This study may be a great method of conducting a baseline protocol to adapt to in further research studies in terms of the vitamin D dosage used, participant age, and the overall duration. This study could be used to determine if repleting vitamin D status in postmenopausal women can make a difference in metabolic health. As of right now, the results are still quite up in the air and additional research is needed. There are definitely components of all of the studies that do show a decrease in metabolic syndrome risk, while some studies don't have any significance in reducing this risk whatsoever. So, additional research and the implications from Ferrer et al. May help to identify and create further research studies to further examine this population of postmenopausal women who are vitamin D deficient and in need of lifestyle management in order to avoid metabolic syndrome risk. At this point, we'll take any additional questions, but if you would like to contact me for additional questions, information, or concerns, please feel free to reach out to me at kgas@une.edu. Here are the references that were utilized in this presentation, and I just want to thank you all for attending, and I hope you all have a great day.